And by the way, if you haven't read his special letter in SNS, Green Tech and How It Must Save America, definitely check that out. It's a great article. And third on our energy and energy conservation list here, we have Tesla Motors, who says saving energy and being energy efficient can't be fun. I'm going to be selfish here. I want to ask, I think the Roadster is fantastic, but when are you going to come out with a car that a guy on a public radio salary can afford?
We have one product on the road, the only roadworthy, road-going production vehicle in the world that's electric vehicle is our Roadster. You've seen them downstairs. The pricing of that is approximately $100,000. Obviously, that has a limited appeal and limited utility. And one of our major focuses on Tesla Motors is driving down the costs, to your point. And our next model, which is commencing development, you probably seen pictures of it, heard about it. It's received a lot of attention, is what we call our Model S. It is a 45-seater family sedan, a lot more utility and affordability. The projected pricing is probably half of what our Roadster is in the region of about $50,000. I think we're starting to get a lot more accessible, having broader appeal in line with our vision of obviously making it more accessible to the market. So from a time point of view, probably 2.5 to 3 years' time. That is our current time projection, and you'll definitely be the first to get a call.
Good. Well, as anyone who has read SNS knows, there's so much potential here with electric vehicles. If the whole country converted to electric cars, we have the electric grid in place. We have that excess capacity at night. People can charge the cars at night. It's just awesome potential there.
Exactly, and I think that's what really excites me about the brand tremendously, is, as you said, the untapped potential. The whole way of creating a brand new automotive company that learns from the past. And just as an example, something that we're really, really pushing, which may or may not be aware of, the convenience in an electric vehicle. It hasn't got an internal combustion engine. There's no pistons, spark plugs, mufflers. You bring your car in probably every 12,000 miles or 1 year for a software upgrade. Our service concept is very much tailored to, let's say, an old-fashioned doctor's house call. We actually have a team of technicians that will come to your home or place of business to conduct servicing or any minor maintenance. So the whole concept is to package this, not and it's electric vehicle technology and all the benefits, and it's not at the expense of design or performance. If you look at our current Roadster, it is basically faster than a Porsche 911 from 0 to 60, and it is twice as efficient as a Toyota Prius. It has very stunning design characteristics which are clearly evident. And so you're getting a complete balance as opposed to a great concept, but then you are losing out in a different area. So we're trying to put convenience, design, performance in one really exciting vehicle.
All right. Thanks, John, and I look forward to hearing about that car that I can afford.
You'll get the call.
Okay, let's move on to the medical field. Next up, imagine if you could program your immune system like we can program a computer. And there are companies that are working on that. It's one way of fighting disease is by developing special antibodies that can attack that disease. There are some drawbacks with some of that antibody technology. They'll attack disease cells. They also can attack healthy cells. The problem is zeroing in on the tissues that you want to treat and leaving the rest of the body alone. Cytomics Therapeutics is working on that. And Nancy, tell me about probodies, because I've exhausted the depth of my knowledge on this topic.
You did very well there, Dave. So Dave's correct. At Cytomics, we're drug hunters, and a couple of years ago we had a big idea, and we thought we'd reinvent the antibody. Antibody drugs have been around for about 25 years. They've been considered great successes because they do very specifically target a drug target and block that. But as the field has watched these antibodies go through various patients, we've noticed that if the target is on healthy tissues, as you brought up, those antibodies can be very, very detrimental. So we decided to reinvent the antibody using our technology, which marries basically what we know about diseases like cancer with what we can engineer in a lab. And so, for example, if you have a colon tumor, it's a very busy area in the body, right? It's growing, it's we know through science literature that there are certain molecules in the tumor that are expressed or uniquely expressed there. They're not in proteases, and so they're enzymes, and they cut things. So we basically study the biology for a particular disease. We know what those proteases are, and we engineer an antibody which often looks like this, and it binds its target in a little pocket. And we engineer an extra bit on the top that reacts to that protease. So when the molecule circulates in the body, if the protease isn't there, it's kind of capped or blocked. And that antibody doesn't bind anything, so it doesn't bind in healthy tissue. But when it encounters the tumor, this gets cut off. And then the molecule can bind to its target and can do its job. And so that benefit in terms of therapeutic index, we think will not only make drugs safer, which of course we'd like to do, and better tolerate it, because I personally think that it's a terrible thing that if you have cancer that you also have to deal with many, many side effects of a therapy that's maybe going to improve your life a little bit. But I think it'll allow physicians to dose higher. So if they're not limited by toxicities, the window, the amount of drug they can give should be much higher. And in theory, that will result in improved outcomes.
Now you're doing cancer trials right now, but this could be applied to other diseases as well, right?
Exactly, yeah. We have we're very early stage. We have 7 employees at Cytomics in Santa Barbara. We have 4 programs going on in early discovery in animals in cancers, various cancers, breast, colorectal, head and neck. 2 of those are with partnered public companies who really like the idea that we've had and have given us their drug and asked us to modify it. And 2 of those are our own novel targets. But absolutely, anywhere an antibody can go, this can follow. So antibodies are very popular for rheumatoid arthritis. They're very popular for MS and pain. So yes, we think this is a big idea and a broad play.
All right. Thank you very much, Nancy.
Thank you.
And thanks for being gentle with me. I'm really over my head on that one.
You did well, Dave.
Yeah, next, as Sharon mentioned earlier, it's right out of the Star Trek sick bay. Moana Medical has these life bed patient vigilance systems, sensors built into the bed that monitor patient health. Patrick, tell me about these. What can this bed do?
Well, we make a coverlet that will transform a bed into a life bed. And we focus on the acute care hospital medical surgical ward. There's about 1 million beds in the United States, 60 to 70 hospital. We address a huge problem, and the debate is in healthcare. We're in the middle of that, really on the front line. The issue we're dealing with is the risk of accidental death from the biggest category, failure to rescue. And so what we do is we track a patient's basic vital signs with nothing connected to them, with this coverlet that we put on any bed. And if they're in trouble, then we call for help. And so we've been on